Well, good morning, good afternoon, good evening to everyone here in the room, and of course also those that have joined us virtually. This discussion on the health and wealth nexus has, of course, been dominating a lot of the COVID-19 debates. What is the impact of public health measures on wealth, on the economy? But it has also opened up, and I think that has been really important, it has also opened up again the discussion of what actually is the contribution of health to wealth. And it has even more so opened up the discussion, and our keynote speaker will refer to that, what actually is the major values we are aiming for within our societies. What actually is it that we want, and should health serve the economy, or is the economy actually there to serve health and well-being? And that's what we meant with that nexus, the health, social, and economic well-being nexus. And that's also an interesting development in the debate around health, that people have, in quotes, rediscovered that part of the WHO definition of health that says it's all about well-being. And a recent very major conference at the World Health Organization in December last year actually worked with the term well-being society, which actually tries to show that goal, that value, that mission that our societies should be aiming to create well-being for everyone, which of course includes the equity dimension right up front. And as we know today, includes the planet and everything we do in that context. So a really, really big challenge, but approaching the health and wealth nexus perhaps in a different way than we did 10 or 20 years ago. And that's also something we're going to take up in the discussion. We have a fantastic keynote speaker. I am delighted to welcome Jayati Ghosh. She's a development economist. She's chairperson of the Center for Economic Studies and Planning at the Jawaharlal Nehru University in Delhi. She's a member of the WHO Council on Health for All, and I'm also very proud to be able to serve with her on that council. And she has also just joined another really important initiative, and that is a high-level board for effective multilateralism that has been set up by the Secretary General. And again, health is featuring very, very centrally within that. So we're delighted, Jayati, you could join us and look forward to your keynote giving us the main direction we should be thinking in. Over to you.
Thank you so much, Ilona. It's such a pleasure to be with you, and even virtually. And I want to take up from where you started about the health-wealth nexus, because, we realize now that it is broken, that wealth does not generate health for all, certainly, and even for most of the population or the planet. And it's broken because policy makers have focused probably on the wrong thing. They have been obsessed with GDP growth and with growing the economy at all costs, rather than generating the conditions that enable sense being for society, for nature. So, as you have mentioned, in this council, the WHO Council on the Economics of Health for All, where I think both of us are very proud to serve, what we're trying to do is reverse that causation. We're trying to say, well, let's think of what we really value and want in a society. We want an equitable, just society in which everyone has reasonable opportunities, where everyone is healthy, and where nature is not being destroyed and the planet is not being destroyed. If we want that, what is the economy we must generate in order to get there? So we're really reversing the issue, and we're not saying, oh, health is important because it gives you so much more, 2 percentage points more GDP growth. We're saying, no, what is the kind of economy? How do we create the institutions, the structures, the policies that will generate health for all, a stable planet, a decent environment, and an equitable, just society? So In that context, how do we do this? As Ilona mentioned, it's huge. It's a very big problem. It can seem insuperable. How do we do this in practice? Let me give you 3 examples of the ways in which this can be done. We know that this has to involve a major increase in public spending, certainly on health, on a whole range of other aspects of well-being that Ilona has mentioned. And this requires fiscal space. We know that most of the developing world simply doesn't have that fiscal space right now more than ever. And that it didn't really manage to increase public spending even during the pandemic, when advanced economies did increase public spending very significantly. So we need to think of ways that we can increase that fiscal space. We need to think about taxation of multinationals that are currently paying a fraction of what local companies pay in tax because they shift profits around. We know that there is a method to resolve this. We know there are international efforts. We need to strengthen those efforts to make sure that multinationals pay their share. We need to bring in wealth taxes. The wealthiest people in the world have multiplied their incomes during the pandemic, yet are paying, again, almost no tax and certainly very little wealth tax. So we can think of ways in which we can generate fiscal space, which also requires international cooperation. We need to govern innovation. I think that has become so clear during the pandemic when we got the development of vaccines with public support, with public knowledge, and yet they have been privatized. They are being provided with monopoly profits going to people, to companies that hold intellectual property rights. We need to make sure that all these vaccines and other treatments are available to everyone for wider production so that we can actually ensure the end of this pandemic. And we have to make this available. We have to govern this terrible, very privatized, monopolized, commercialized system of intellectual property. We have to change that so that new knowledge is done for the benefit of societies and people and the planet. And we are going to need this more and more as we face other problems coming from health challenges, from climate change, and so on. We also have to think of our food systems. They are really currently broken. And it's not just the pandemic that has done this. We know that the globalized system of food production was creating unhealthy and unsustainable patterns of consumption and distribution. And this is part of a system where you are encouraging much more greenhouse gas emission as well, while depriving half of the world of the means for adequate nutrition. The post-pandemic scenario has made things much worse. Now the price rises, partly from the Ukraine war, partly because of speculation in food markets, has actually generated massive price increases in the poorest countries of the world, where people can already do not have the money incomes to buy minimum food, and they are facing even higher food prices. We need, therefore, to think of the economic policies that will deal with this, including regulating the financial markets that are enabling speculation in food commodities, including ensuring that hunger and food provision become basic elements of what public policy tries to ensure, trying to prevent the more unhealthy patterns of food consumption, which are proliferating in both rich and poor countries through fiscal and other incentives, and working in different ways to make sure that actually the food system contributes to human health, to social well-being, rather than to a much worse and more unequal context. These are just some examples. There are many, many ways in which we can think of how the economy can be changed. And it can be done. It requires very little, really. It requires political will, it requires legislation, regulation, and it requires public spending. But if we demand this sufficiently, we can bring back a positive health-wealth nexus. And I think that is really what the hope of this summit is, and what I certainly would like to work with you towards. Thank you.
Thank you very much, Jayati. And you were, of course, also echoing a whole number of issues that have been raised during the first day of this summit already, and in a range of the background materials. And I think one point that you raised, how much the financial markets are part of this, is really important. From the health side of things, one often looks at companies and whether companies are producing healthy or unhealthy goods, and how they are distributed around the world, etc. But actually what we have not done enough is look at the financial system, look at the investors, and actually we do have concrete examples where companies have actually wanted to move in the direction of health, but the investors, the large equity firms, etc., have not allowed them to do so for reasons of profit. And of course, some of the unhealthy foods, drinks and alcohol are some of the most profitable industries in the world. And here we can see how a Health-Wealth-Nexus also works in a different way. Jayati is going to stay with us. She's going to contribute again to the panel. So thank you again, and it's my great pleasure to now introduce the panel. I'm very happy that one of the panel members is here with us and will join us on the panel. It's Hatice Kukuk-Beton, who is with Sovereign Strategy. She's the CEO and Director at the G20 Health Development Partnership. Please do come up and join me. I'd also like to introduce the other two panel members. I hope we can see them in a minute. It's Mr. Roy Himawan. He is the Planning and Information Coordinator of Pharmacy and Medical Devices, Ministry of Health of the Republic of Indonesia. And we have with us Christina Wadwani, who is with the Division of Oncology, Policy and Healthcare Systems at Novartis. I hope we will see them at some stage. And it is my great pleasure also to say at this point that this session has been curated by Sonja Haut from Novartis. She has put an incredible effort into bringing us all together and taking this forward. The way we're approaching it is we're having two rounds with the panel members and hope to end more or less on the dot. I live in Switzerland, so I always try and do that. And that also sort of focuses the mind if you know that you have to move forward. The first round of our discussions, and I'd like to start with Hatice there, is really to say, what are the key challenges, if we try and focus in that we want to address? And working with the G20, working with these investment questions on a day-to-day basis, where do you see those? And maybe, Hatice, you also want to refer to the fact how our discussion around investment in health has actually changed, because that also means the G20 needs to address it differently than perhaps we did in the past. Please, over to you for a short statement.
Here with you today, and glad to share the stage with you. As you said, I would like to share with you my experiences since 2017. As you know, together with my chairman, Alan Donnelly, we're trying to work with G20 presidencies, starting with Germany in 2017, to advocate why health should be seen as a positive investment into socio-economic growth and stability. And interestingly enough, during the Japanese presidency, Ilona 2019, for the first time we achieved the goal that health and finance ministers were actually sitting on a table and discussing the future health financing strategies on UHC. Shortly after, the Saudis took the stage. Saudi Arabia had the presidency in 2020 during the pandemic, and it was interesting to see the trend, whereas after Japan, we found it difficult to keep the health and wealth nexus on the G20 agenda. With the pandemic, luckily in this context, the Saudi Arabian G20 presidency took the health financing case up to higher up their political agendas, and they continued the G20 health and finance meetings. As a concrete output over the years, as you will see during the Italian G20 presidency, they have, for the first time, initiated the creation of a joint G20 Health and Finance Task Force, which is a bit similar to the Financial Stability Board. It started with this idea, and it was meant to measure and look at how we can basically control and monitor future investments in health, and how we can create a fund without reinventing the wheel, hopefully. I come to that in a moment. So that we can early identify future pandemics. So to your point, when we spoke earlier, I keep it brief, you said since 1998 you're part of discussions where you speak about health and wealth. Well, now we speak about it again. We have many initiatives created, like the Pandemic Preparedness Board, the IPPR, now the Economic Council. But what is it now? We're at the next stage. How can we scope? How can we build focus into our initiatives and make sure that really we can prevent the next pandemic and have the funds ready and measure our investments in G20 plus nations so that we do not end up having budgetary constraints? Over to you.
Thank you very much, Atisha, for sort of focusing in on that investment. And of course, while we all speak about investing in pandemic preparedness and response, we are very aware of the fact that we need to invest in universal health coverage, into primary healthcare, into public health. We have to look at the whole system. We can't sort of divide off just the pandemic part of it, particularly if we're looking at a global challenge where so many of the other diseases, of course, are present. And we should actually aim to move towards an integrated approach and integrated financing. We're very pleased to have, as I said, Mr. Roy Himawan from Indonesia here with us. I can see you now. Welcome. And I'd like to ask you the question also from the perspective of Indonesia and what you hope to achieve with the G20 summit, particularly looking at each G20 countries, of the countries, you know, how do we generate what Jayati said, that political will to move in that direction? And has your own country been able to go forward and say, we have engendered the political will to really establish this investment in health and well-being for our populations? Please, Roy.
Yeah, thank you, Elona. I hope my sound there. Good morning and good afternoon, ladies and gentlemen.
Breaking up a bit.
What we have prepared for our presidency in this. Sorry.
Okay, try again. You were breaking up, so we were losing some of what you were saying. So please go ahead.
Okay, thank you, Alana. I will make it straight by saying that our presidency in this 2022 for G20 will be focused on how we can make the global health architecture being stronger and stronger again. So with the leadership of our president and our Minister of Health, we are proposing the three elements to be built upon our presidency. The first one is about the building global health system resilience through the financial resource mobilization for pandemic prevention, preparedness, and response, and essential health resource mobilization for pandemic prevention, preparedness, and response, and also optimization of genomic surveillance and strengthening trusted data sharing mechanisms to provide incentives for robust global public health. The second one that we would like to achieve in our presidency is how we can harmonize our global health protocol standards with, by saying that harmonization of COVID-19 and other vaccine preventable disease certificate recognition at point of entry will be acknowledged in every country that we have. And also the last one that should be make it stronger again is about how we can expand our global manufacturing and research hubs for pandemic prevention and response. We'll talk about the expansion of global manufacturing hubs for vaccines, therapeutics, and diagnostics to developing countries, and also sharing knowledge for prevention preparedness through the research hub. So Elona would like to stress that we would like to make the global architecture of health will become stronger with these three pillars. In our country, yes, we have experienced the last 2 years full of pandemic, very hurtful years for every of us. And yes, from this, we can move to our next agenda to transform our health system, Alona. So in our health system, we will transform our condition of mobilization resource to be health oriented. So by saying, let's say, by increasing the coverage of national health insurance, by increasing the effectiveness or the analysis of health technological advancement, and also how we can make the public-private partnership being improved on our health aspect. So this is what I can say as for an introduction. Thank you, Alana.
Thank you very much, Roy, and thank you for looking at both these dimensions. And I think it's very interesting as countries take on the G20 presidency, like yourself, like India following on, that play such an important role in global health and at the same time are in the process of developing their own health systems forward, this interface between the national and the regional challenge and the global challenge, I believe, is a very, very important one. And you've highlighted this interface of also, on the one hand, needing to find regional and even national solutions. You were referring to production, for example, but at the other hand, ensuring that global interfaces continue to work, like in terms of global supply chains and the sharing of innovation. So a really big challenge that is coming our way, and Jayati already spoke of, how do we approach the intellectual property questions that are related to that? How can the technology hubs WHO is now setting up really lead many countries to share their knowledge and their technology? So I'll move to our third panelist, and would very much like to ask Christina, who I also introduced earlier, to perhaps look at this from the perspective of business, of the private sector. Roy just referred to it. Many of these movements that we have to make require a responsible private sector, a private sector that's truly engaged also in creating health and well-being. And Jayati referred to it that not all parts of the private sector work in that direction. You're particularly involved with the health industry. What do you see developing here? What are the biggest challenges?
Sure. Thank you. Can you hear me?
Yes.
Everybody can hear me? Okay, perfect. Thank you. So thank you for this opportunity. And it's great to share the space with the esteemed speakers, Ms. Hatice, Ms. Ilona, Jayati, and Mr. Roy. Thank you. So as you said, Ilona, from my perspective, we're representing the Health System Strengthening Unit within Novartis. I think we face a lot of the same challenges as most everyone. So during this time of crisis, you have to make decisions that are actually quite short-term. Short-term cuts on spending for health programs, short-term spending on things that you may not see results in the long-term future. And that results into things being cut that are nice to haves. And so we have seen that, especially with our colleagues in countries that are resource restricted. Their health systems became overwhelmed. I can give an example. We have an office in India, and we work with several states of India around cancer. Many of the patients stopped treatment. Healthcare facilities stopped doing diagnosis and prioritized COVID and prioritized, emergency care. What we also noticed was we were already delayed in NCDs before the COVID pandemic hit. So we've missed NCD targets, and we look at trends throughout 2016, only about 17 countries out of the 176 were on track for NCD goals. And so from that perspective, what we try to do as a private sector working in the healthcare space, we do try to take a systems approach and not so much of a disease silo approach, which do trap not just us as a healthcare company, but also trap governments into financing aspects that you then finance specifically on disease areas. I'll give an example. If you strengthen primary care and you strengthen healthcare, human resources in the healthcare sector, if we make it specifically for only cancer or only hypertension or only diabetes, we fall back in that cycle. What we are trying to do is not make it so disease specific and say strengthen overall primary care, strengthen overall the capabilities of your healthcare providers, upskill and provide updated trainings. From our perspective, I work with Amy Israel, who unfortunately couldn't be on the panel today, but she actually runs an innovative model at Novartis where we support country teams, country colleagues, specifically low and lower to middle income country partners to run these innovative pilot models. So we call them incubator models for system strengthening. We provide some catalytic funding or technical assistance support, capability building support. Our country colleagues need to work closely with governments, with ministries of health, departments of health, or the different departments that implement healthcare. And we try to see if we can test models that do have a sustainable impact. We try to stay away from short-term objectives and kind of 1 to 2 year results because we don't want to be a part of that problem as well. So that's a very quick intro of what we try to do, very little from our perspective.
Thank you, Christina. And with sharing that with us, you've also highlighted some of the challenges that we face in terms of global health investments. Because we made a major step forward in what people call the global era of the golden era, I must say, of global health, which was the investment in large new funds, disease-specific AIDS, tuberculosis, and malaria, a vaccine-oriented like Gavi, etc., etc. And we were actually moving in that direction as well with the non-communicable disease area. As you said, let's fight diabetes, let's fight cancer, etc. And the challenge we see now, and the COVID-19 has really brought that home to us, that if we don't have a resilient health system as an entity that can deal with any of the crises that come our way, then we are truly sunk. Then we have a major problem. And we've seen that with resources, even in health systems that are very weak, having had to go to COVID rather than anything else. And mothers and children were dying, children were not vaccinated anymore, etc., etc. One could come up with a whole range of issues. So this notion of resilience that was also picked up this morning in the opening sessions is becoming more and more important also in the health systems debate. And therefore, we need to take that up as a mix, I think, and here I come to you, Hatice, again, a mix of the resilient health system on the one hand, linked with sustainable financing on the other hand. Because you've rightly indicated it was a breakthrough when Japan said, let's put health and finance ministers in one room. We are no longer talking just about overseas development assistance in health. We are talking about something much more profound. Could you speak a bit on that?
Yeah, sure. As you said, Ilona, the problem was that diseases were always seen in silos. So when we started this initiative, the TB community came to us, malaria community, and the HIV community and so forth. We realized, to the former speaker's point, it is about systematic changes that we need to speak about. So we really need to look at what does bring all of these actors together. I mean, the current pandemic is COVID. The next pandemic is NCDs if we don't tackle it by 2030 or reduce it. AMR is another challenge. So how can all of these public-private stakeholders come together to make common messages to the G20 to tackle these systemic risks? And only then we realized, when you speak to policymakers and finance ministers, they realize what the systematic change or the challenge of the basically of many disease areas may have on the global common good or the society and economy. Then they react. And when it comes to sustainable financing models, Ilona, 2019, together with around 30 organizations in the global health space. We compiled a nice report, only 2 pages, because you will know it, the global health community loves their 1,000 pages of reports. And we said, give us 2 pages, let's say the case of Gavi. What is it that you have invented? It was the IFM Gavi bond. How have you gone about it, and what impact did it have on G20 plus countries, so also the global south? And by looking at these statistics, we were handing that into G20 finance ministers, and they could see the money that has been invested, be it donor funding or conditional funding, had actually an impact on a society, on education, employment, or even economic stability and growth. And that way, we realized how slowly but surely finance and health ministers start talking the same language again. So the future models, Ilona, that we need to look into is, we both know that, donor funding alone and philanthropy funding alone will not close the SDG funding gap. So now it's the question, how do we bring the investor community together, asset managers, investors, and incentivize them to invest into a development of a product or training of nurses in certain countries, and to show them what kind of return on investment or even return on value it may have. Because one thing was clear, Ilona, to us in our discussions with big banks and investors in the pandemic, they were actually keen to invest. But there was a political miscommunication where the global health community didn't know how to speak to the investor community. And I think we need to bridge this gap, because when you look at climate change, with green bonds, that we have hundreds of green bonds, there are lessons to be learned. And what we want to do as part of this year's agenda, because we think the G20, it's a groundbreaking moment to really implement the lessons learned. We want to develop a nice toolkit for G20 or other countries around the world to see what kind of innovative financing models do we have out there. Blended financing initiatives, conditional finance initiatives. How can we bring them together in a toolkit and hand it to the G20 in Indonesia or to other governments to learn from each other? It's not always like big magic, right, how these things work. It's just you can learn from each other, and there are many, many examples that are out there.
Thank you very much for that, and thank you also for highlighting that there is a lot of examples out there, that not every move that we make needs to be all-encompassing, but that we can move forward. I very much like your point also about learning from the environmental and climate movement and some of the financing instruments they have created. Whereas, also Gavi was quite creative in starting very early with a bonds approach. But I think the other thing, and that's where I come back to you, Roy, you mentioned the language, the paradigm in the head, the understanding. And many of the discussions we've had also with finance ministers was the fact that even the understanding of investment is so deeply different between what the health community comes along with when they bring their investment case for malaria, for example, and the way a finance minister looks at the investment, and also, let's be honest, the return on investment in the country. And I'm sure Jayati will come back to that. What is that return on investment? Does it include health? What are the measures? What values does it relate to? So Roy, if you think that forward, what are some of the things you hope to be able to resolve within the G20 presidency? When would you say we've been really successful on global health because we've been able to do X? Hello?
He's frozen, I think.
We can't hear you, Roy. No Sadly, we can't hear Roy. I'll come back to you in a minute then, and maybe go to Christina and say, what are some of the solutions in terms of a much more multi-stakeholder partnership approach that you'd like to see in this health-wealth sphere? Where do you think are the most productive areas to work together?
Sure. I think Hatice, you kind of hit the nail on the head, which was, bringing different multidisciplinary, multi functions together. So oftentimes, and in my career working in global health, the first ministry that we always go to is always the Minister of Health. Only recently did we kind of try to think a bit more innovatively and say, okay, if we're looking at strengthening, for example, digital registries, why are we not including the digital Minister of Innovation? Why are we not also including Minister of Finance? So I think one, from a private sector perspective, to be a bit more intent and thoughtful with who we are trying to engage rather than our typical healthcare players. We've seen some examples, a great example in the US, where we know things are sometimes not so perfect, but we have seen there's a reignition of it's a movement called a cancer moonshot in the US, and it was a cancer cabinet that included multiple different federal agencies, from Department of Defense, Energy, Agriculture, Environmental Protection Agency, Gender Policy. So it's a quite inclusive and holistic approach for addressing a health issue. We also saw in 2019, there's a great example in Portugal. It was a legislative amendment to Portuguese employment code that granted employment protection for patients with cancer, for patients and children to take time off. And this was signed right before the COVID epidemic hit. So I think within Portugal, we can learn a lot. From our perspective, I think what is critical for us moving forward in 2022, after all of these learnings from COVID, is taking a systems approach, as I mentioned before, which I might be repeating myself, not a silos approach, and start measuring impact rather than just multiple activities, strengthening that primary care, but at the same time, not ignoring the potential of reducing treatable deaths. So oftentimes, if we spend a lot of energy on primary care, we think about things that are much early on, diseases that are set early on, or different issues. So how can we find that happy medium, that balance? And we're trying very hard to do that. There's one more
No,
thing.
sorry, Christina. I have to move on to Roy. He's happily connected again. And I do still want to give him the opportunity to say something, and then for Jayati to give us some final comments. Roy, what would you hope would come out from the Indonesian G20 presidency on this health-wealth nexus? If you say there's one thing we've achieved, what would you want that to be?
Yes, thank you, Alona. Well, if I think that we can have as a nexus for health and wealth, I would say that the improved expanding of the manufacturing capacity of vaccines, therapeutic and diagnostic should be the nexus. Should be the nexus that every region has the same capacity to produce the need of vaccines. Is that we should improve on this nexus.
Thank you very much for that. I think a very, very clear statement I'm sure Jayati will come back to, because everything we do in this health-wealth nexus, of course, must have that equity focus. And that equity focus between countries, that there are not the wrong types of dependencies, that there are also not the wrong type of restrictions. Think of vaccine nationalism that we experienced, but that we really also work towards a more equitable global health in general. Jayati, over to you. Comments?
Thank you so much. And this has been such an interesting discussion. Yeah, I want to get back to this issue about doing the positive versus the negative things. I think some really excellent examples of how you can work with the private sector, the kinds of innovation that we can do when we involve the private sector as well. They're very important. But I would like to stress that that's not enough. In other words, you see, it's not just enough to do some good things, because some of those good things can be impeded, like the mRNA hub that WHO is trying to set up in South Africa, is impeded by the requirement that they now have to do something about the patent restrictions on all the different elements that they're trying to use for that hub. Similarly, it's not enough just to encourage some good financing for health, because too much of the other incentives in the market are going in the other way. So this is not a problem of particular companies. This is a problem of the way the market incentives are structured. So we have to shape the markets. We have to make it. Climate finance is a very good example. There are, yes, many new different types of bonds and blended instruments for climate finance. These are not even 1% of the money going from private finance to brown investments, to coal, to fossil fuel generally. Not even 1%. Why? Because the market incentives are all in that direction. So we have to shape that market. We have to regulate. We have to do fiscal incentives that say, if you finance the brown investments, there is a cost. You will either face a higher tax, or you're not allowed to do more than a certain amount. We have to do something that way. Similarly, we have to say, for example, that we will not allow regulation to spread, to inhibit the spread of new hubs and new places where we can manufacture vaccines, diagnostics, treatments, etc. In other words, we need to therefore regulate the intellectual property regime. So it's investments and new initiatives are excellent, very good, and to be welcomed, but they will not be enough. In fact, they're not even a tiny fraction, a drop in the ocean of what we need. We must think of shaping the markets through regulation and through fiscal incentives and disincentives. I bring back that point. It's an individual company may want to do something good, but they will be punished by the share market. They will be punished by shareholders if they do that, because the profitability will fall. We have to make sure that everybody faces that same issue, and therefore it's not so profitable to do the bad stuff. It is much more profitable to do the good stuff.
Thank you very much, Jayati. We're coming to the close of this exciting panel. We heard about the moonshot, which is basically setting yourself a new type of goal. And of course, the chair of our Economic Council, Mariana Mazzucato, has used that terminology to say, let's set ourselves moonshots for the social goals, for the other types of values we have in our society. And within that, I'd like to leave you with this thought about, shaping the markets for health. Health is one of the largest industries in the world. We often don't think about that enough. And of course, if you were to add all the industries that have a significant impact on health, what we call the health determinants, then you're talking about very, very large markets. And it's also not only about investment, it's also about divestment. And we've seen, how the movement for divesting in fossil fuels has given colleagues in the tobacco sphere the idea of divesting from tobacco. And actually, the two of them have, a lot of things in common in terms of destroying our environment, of destroying livelihoods of farmers, etc., etc. And that's maybe the last thought I'd like to leave you with, how strong the interface, how strong the systemic dynamics between the many issues that we are discussing. If we're talking health, we're talking environment, we're talking agriculture, we're talking food, as Jayati said, and now with the impact of the Ukraine war and the hunger crises that is going to mount in our societies, we're going to see all kinds of impacts that one will have to deal with, including a social impact on people. And if health is about equity and well-being, then we have to look at the health-wealth nexus in these new ways with a totally new paradigm. And I hope from this Global Solutions Summit, we'll be able to take some of those ideas forward. Thank you very much. On the dot. Okay, bye-bye.